Hello dear patients. Today we are going to review the case presented on the picture. This is a case of gonorrheal urethritis. A young man came to us. He is from Uzbekistan and working here in Russia. He had no insurance. So he had a contact approximately 2 weeks ago, and in 5 days quite strong discharges started. However, he didn't get a treatment, as he had no financial possibility, and he put a bactericide plaster on urethra, so that pus that goes out doesn't make underwear dirty. As a result of that, erosion was formed on glans penis, around the pus that goes out. So-called maceration happened. This is when gonococcus invades the skin of glans penis, as well as it's very thin and it induces gonorrheal ulcers. In a separate video we covered the topic of gonorrheal skin lesions. You can watch a separate video about it on our channel. We are not going to cover it now. On microscopy of smear from urethra, gonococcus was found. A complex PCR analysis for 15 infections was done, and in it, gonococcus and mycoplasma genitalium were found. As a result of that, both of these pathogens had to be treated, the more so that the result of their influence on urethra is visible. Injection medications were prescribed, including rocephin, as well as enzyme medications. In the second half of treatment, a washing of urethra was prescribed. Antibiotics were also prescribed. First it was minocycline. This is an antibiotic that acts on both causative agents, and then it is more aimed at mycoplasma genitalium. So the time of treatment was 2 weeks, and after that the patient was discharged with some mucous discharges, which is quite normal after such big and long-term discharge from the canal. Observation was recommended, and he did control analysis only once, approximately in 3 weeks. However, it was recommended to do it more often, but he didn't have such opportunity. As a result of that, gonococcus or mycoplasma genitalium were not found in PCR analysis. Only some leukocytosis remained, of about 10 to 15 within a visual field. This can happen for quite a long time, sometimes for up to 6 months, after such acute cases of urethritis that are not treated for quite a long time. So, during any symptoms, you should consult doctors specialists as soon as possible, and you shouldn't treat yourself, as at least this can spoil analysis that are required in this case. If he took some tablets, then it's not the fact that we could find both of pathogens that require treatment, and it's not the fact that a correct course of treatment would be prescribed. So, during any rashes, discharges, burning in the area of sexual organs, you should consult venerologists and urologists. You can consult such specialists in our clinic of paid medical center of Dermatovenerologic dispensary in Moscow. We are waiting for you. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.